Thank you for having me here. I'm going to talk about a current hot topic in the field of gastroenterology and nutrition, using a low FODMAP diet to treat irritable bowel syndrome, or IBS. IBS is a fairly common condition in Australia. According to the latest numbers, IBS develops in as many as 1 in 5 Australians, or 20% of the population at some point in their lifetime. Looking outside of Australia, about 15% of the global population, or 1 in 7 people worldwide, struggle with IBS. An interesting fact is that women are twice as likely to develop IBS as men. A bit of background on IBS before moving into the main topic of the day. IBS is a symptom-based gastrointestinal disorder for which there are no diagnostic tests. Instead, IBS is diagnosed after ruling out other digestive conditions such as Crohn's disease and celiac disease. IBS is characterized by irregularities in bowel habits, such as diarrhea, constipation, or a combination of the two. The contradictory nature of symptoms, as well as their tendency to change over time, makes this a very difficult disease to manage. While the cause of IBS is still unknown, its development and flare-ups are thought to result from problems in the interaction between the gut, brain, and nervous system. Many people who develop IBS do so during or after particularly stressful life events and experience flare-ups in the presence of strong emotions. IBS is unpredictable, making it difficult to manage for healthcare providers and their patients. This unpredictability, combined with the nature of the symptoms, means that IBS has the potential to interfere with many aspects of patients' lives, and if left untreated, it can lead to unintentional weight loss, nutrient deficiencies, and depression. Treatment for IBS can include medication such as antidiarrheal medicines, painkillers, constipation treatments, antispasmodics to treat the symptoms of the disease. But they don't get at the potential underlying causes of the problem. Another part of the treatment plan for IBS is a change in diet and lifestyle. This is where the low FODMAP diets come in. As previously mentioned, IBS is an unpredictable disease and presents differently in each patient, so a FODMAP diet may not be appropriate for all patients. Now, let's get into what the low FODMAP diet is all about. FODMAP stands for fermentable, oligo, di, and monosaccharides and polyols, and excludes popular and flavorful ingredients like onions and garlic, which can make sticking to a low FODMAP diet quite challenging for patients. This is where registered dietitians come in, as it is part of our job to make the low FODMAP diet sustainable for patients. We will get back to this later. Next, I want to give you a bit more information about the diet itself. The diet begins with an elimination period in which FODMAP-containing foods are limited. FODMAPs are short-chain carbohydrates, including lactose, fructose, fructans, fructans, and galactans, found in some grains, fruit, vegetable, legumes, and dairy products, and are difficult for some people to digest and absorb. In addition to garlic and onion, other FODMAP-containing foods are artichoke, asparagus, celery, kidney beans, pickled vegetables, cherries, pears, and cashews. What happens is when FODMAPs reach the small intestine, they move slowly, attracting water, and then as they pass to the large intestine, FODMAPs are fermented by gut bacteria, producing excess gas. The extra water and gas causes the intestines to stretch the gut, which is particularly painful for people suffering from IBS, as they already have a highly sensitive gut. After an elimination period of 4 to 6 weeks, foods are gradually reintroduced to determine which foods trigger IBS symptoms. Once a patient's trigger foods have been identified, a dietitian can support the patient in developing a well-balanced eating plan whose objective is to manage future IBS symptoms. Research has shown a low FODMAP diet to be helpful for improving bloating, abdominal pain, and flatulence among individuals with IBS. As I mentioned earlier, it won't work for all IBS patients, but it is certainly worth a try for those patients who haven't had success with other dietary changes. As you can imagine, following a low FODMAP diet, even for a short period of time, can be challenging, especially for patients who don't have the ability or time to cook their own meals from scratch. Fortunately, more and more companies have started to offer low FODMAP products that help people to follow the diet more easily.